Hi everybody, I wanted to walk you through a trap trigger point treatment on my lovely patient here. Now, I already got right into it, but I mixed the lidocaine and the tox for her trigger points already. So that is kind of what I'm putting together. And this is a 25 gauge 1.5 inch needle to make sure that you're truly getting into the belly of the muscle. With that being said, I had already done a very thorough assessment on her, one that we do treat for during our TMJ courses. So this is when we kind of consult the patient, we mark the patient up, we figure out what we want to treat and trigger, which is when you are kind of working that trigger point with a needle, breaking up the tension and laying some toxin lidocaine. So there is a little bit of a science to this. I didn't just kind of put some X's on her back and kind of start to poke her with a needle. We did figure out where those trigger points are for her. And you can see she has 4, and you can even see I'm always isolating that muscle. You can see how inflamed it is. It's almost aggravated and irritated. And myomodulation can happen when that muscle kind of twitches too. And you can really tell that you got into a trigger point when that happens. So I'm just breaking it up and kind of working on it. So keep that in mind. Always want to be careful, know your depth, know where you are on the patient, the anatomy, and always the angle that you're going into. And I'm just working on it. It seems very aggressive. That is one thing I would kind of want to point out. This is not an aggressive treatment. It feels very, very good for the patient. And she, clearly is doing just fine and is actually loving it and talking about how good it feels. I'm just stretching her out, and I recheck range of motion just to kind of see where we're at and make sure that she's feeling better, smooth it out, rub it out. It's like a nice little massage, a nice thing to do. So again, this is something we teach in TMJ.